Today our topic is Venepuncture. First we should gather the equipment, collect all the equipment needed for the procedure and place it within reach on a tray or trolley, ensuring that all the items are clearly visible. Clean the procedure tray, non-sterile gloves, tourniquet, blood sampling device, example, butterfly needle and a barrel. The size should be appropriate to the bean and the sample requirements. Blood specimen bottle, sharp container, alcohol swab, gauze or the cotton wool, sterile plaster and the laboratory form, label and the transportation bag. Introduction. Wash your hand using the alcohol gel if your hands are visibly soiled. Wash them with soap and water. Then PPE is appropriate. Introduce yourself to the patient including your name and the role. Confirm the patient name and date of birth. Briefly explain what the procedure will involve using patient-friendly language. Today, I need to take a blood sample which involves inserting a small needle into your vein. You may briefly experience a sharp scratch as the needle is inserted. Gain consent to proceed with the venipuncture. Check if the patient has any allergy. Adequately expose the patient arm for the procedure. Position the patient so that they are sitting comfortably. If a bed is available, the patient can lie down for the procedure. This is sometimes preferable, particularly if the patient is prone to vasovagal syncope. Ask the patient if they have any pain before continuing with the clinical procedure. Choosing an arm. Choose an arm to perform the venipuncture on. You should ask the patient if they have preference. Pre-existing medical condition may prevent the particular limbs from being used to. Example, arteriovenous fistula, lymphoedema, a stroke affecting the movement of a limb. Do not perform the venipuncture on an arm that has an intravenous infusion in progress, as this may alter the blood test result. Place a pillow under the relevant arm. Inspect the patient arm for the appropriate venipuncture site. The median cubital vein in the antecubital fossa is commonly used for the venipuncture. Areas of broken bridge or the erythematous skin should be avoided. Areas in which the two veins join should be avoided where the possible as wells are often present. Position the patient arm in the comfortable extended position that provides adequate access to the planned venipuncture site. Apply the tourniquet approximately 4 to 5 finger widths above the planned venipuncture site. Palpate the vein you have identified to assess if it is suitable. Tapping the vein and asking the patient to repeatedly clench their fist can make the vein easier to visualize the palpate. An ideal vein feels the springy. A vein that feels hard is likely sclerosed, thrombosed, or the prebitic that is inflamed should be avoided. Once you have identified the suitable vein, you may need to temporarily release the tourniquet, as it should not be left on for more than 1 to 2 minutes at a time. Wash your hands again. Turn gloves. That is, the gloves don't need to be worn for cleansing the site, but they should always be cleaned prior to performing the venipuncture itself. Clean the site with an alcohol swab for 30 seconds and then allow to completely for 30 seconds. You should start cleaning from the center of the venipuncture site and work out towards to cover an area of 5 cm or more. Do not touch the cleansed site afterwards at any point. Otherwise, the cleaning procedure will need to be repeated prior to the venipuncture. Reapply the tourniquet if removed previously. Attach the needle to the barrel. Some blood collection systems can be pre-assembled, such as the butterfly needle with the barrel shown in the video. Unsheath the needle. Anchor the vein from below with your non-dormant hand by gently pulling on the skin distal to the incision site. Warn the patient that they will experience a sharp scratch. Insert the needle through the skin at the 30-degree angle or less with the bevel facing upwards. You should see the flashback into the needle chamber and feel a sudden decrease in the resistance as the needle enters the vein. Advance the needle a further 1 to 2 mm into the vein after flashback is noted to ensure that you are within the lumen. Lower and anchor the needle to the patient's skin using the wings of the butterfly needle. Attach each blood bottle in the correct order of drop to the barrel and allow them to fill the appropriate level. Make sure to continue to anchor the needle to the skin as you remove each bottle from the barrel by gently pulling and twisting. If no blood begins to flow into the bottle, tie slightly withdrawing or adjusting the angle of a needle, release the tourniquet. Withdraw the needle and then apply gently pressure to the site with some gauze or cotton wool. Ask the patient to hold the gauze or cotton wool in place whilst you dispose of the needle into the sharp container. Applying a dressing to the patient's arm, cotton wool, gauze or plaster. Invite each of the blood bottles the suggested number of attempts based on its color. Discard the used equipment into the appropriate clinical waste bin. Number of times to invert the blood bottle. Inversion aids the mixing of the blood sample with the blood bottle additives. The recommended number of times a blood bottle should be inverted differs depending on the bottle blood color. Light blue 3 to 4 inversion, gold or yellow 5 to 6 inversion, purple 8 to 10 inversion, pink 8 to 10 inversion, and grey 8 to 10 inversion. Blood test and order of draw. Different blood tests require the different types of a blood bottle to be used. In addition, the blood bottle need to be filled in a specific order to both reduce the chance of sample contamination and improve the accuracy of the result. Below is a list of common blood bottle types and associated blood tests organized by the recommended order of draw. Blood culture. This bottle should always be attached first with the aerobic sample preceding the anaerobic one. Light blue, coagulation screen, INR and D-dimer. Gold or yellow, urinalysis, CRP, LFT, amylase, calcium, phosphate, magnesium, TFT, lipid profile and the troponins. Purple, FBC, blood film, ESR and HbA1c. When it is pink color, the group and same allowing for the cross matching. Gray, glucose and lactate. If your first bottle is light blue and you are using the butterfly needle, you will likely need to use the two of this blood bottle to obtain the full sample. This is because when you attach the first bottle, it will draw in air from tubing, resulting in a sample that is unable to fill with enough blood to reach the required level. To avoid this, you can initially attach the light blue bottle to remove the air, fill the tubing with the blood, then detach this and fill a second blood bottle to the required level. To complete the procedure, explain to the patient that the procedure is now complete and that they should seek the review if the venipuncture site becomes painful or inflamed. Thank the patient for the time. Document the patient details on the blood sample bottle at the bedside. Dispose of PPE appropriately and wash your hands. Send the blood samples to the lab for the analysis in an appropriate plastic leak-proof bag with the completed laboratory request form. Thank you.